You're with the news at 1 on RTE Radio 1. The government is again in the firing line over health, this time over the abandonment of its pledge to extend free GP care to almost 60,000 people with long-term illnesses. The Irish Times today reports that ministers now accept there's no prospect of it being introduced this year, even though it was promised for 2012. Stay with us, Alex White, if you wish. You may wish to comment or respond to Caoimhghín Ó Caoláin, the Sinn Féin. Apologies for that. A Sinn Féin Health spokesperson, Caoimhghín Ó Caoláin, having listened to the minister, maybe it's a bit, you're pushing it a bit far to say their policy or their strategy is now in tatters.
No, not at all. I mean, we have to recognise that the health policy of this government very clearly committed to, in the first 12 months, deliver what now they are in the process of abandoning. And no amount of wordplay by Minister Alex White will disguise the fact that the government have indeed abandoned a key election commitment. And for the almost 60,000 people who have long-term illness cards, you know, the fact that 2.5 years into this government's term in office, that they're not now going to receive the extended cover to have GP access is a hugely disappointing development, and something that will create great difficulties and concerns indeed for many other sectors, because make no mistake about it, this is on the back of further measures that were introduced over the Easter period, and that Minister White only last week in the Dáil tried to peddle as if it did not impact on the government's plan for free GP care for all. And I'm talking about the home improvement loan repayments no longer taken into account, the €50 transport allowance to work for medical card entitlees. All of these are impacting seriously on people's right to GP and other medical care.
The central defence for dropping, abandoning, making or not making it happen, the promise to the 60,000 people, was that there was a legal difficulty about basing entitlement on the illness as opposed to people's means. Do you accept that that is a genuine legal, perhaps bordering on a constitutional problem?
No, I'm not convinced that that's the case, and I don't believe it takes 2 years and 3 months to establish if there are legal difficulties. Minister White talks about, that this can't be based in relation to particular medical circumstances. But, surely in the minds of most, it's the medical needs of people that should be the first consideration. And I would believe that the inclusion on the programme of the rollout of GP care access for all of the long-term illness people. I mean, we're talking about people with diabetes, cerebral palsy, epilepsy, cystic fibrosis, to name but a few. These people are most deserving of this further support.
And you don't see the difficulty, you don't accept that there's a legal difficulty, clearly?
Well, I'm not buying into it. There's no explanation, there's no detail, and for the Minister to talk about having a plan before the summer, they've had a plan for the past 2.5 years. It was not only a commitment in the election period up to February 2011, it has been enshrined in the programme for government ever since, and now it is, as I've already said, in tatters.
But at the same time, he has given us an assurance that we're going to see the plan for free GP care for all in the lifetime of this government. We will see that by summer. Now, surely that's something that's very clear, that's very understandable, and it's very punishable as well if it doesn't happen.
Well, it's very clear, and how punishable it will be, we will have to wait and see. The fact of the matter is that this government have made commitment after commitment. I mean, it's not only in relation to GP care for all, it's the universal rollout. We've never even seen the white paper yet. I mean, they have only got a list of failures on delivery, and I have to say that the health policy that was pursued by the former government is now absolutely in situ, very disappointing, and this government have made no impact over the 2 years plus of their stewardship.
Well, that, of course, is nonsense. I sometimes think when I listen to Caoimhghín that his biggest fear is that we might succeed in these matters.
Well,
that's
sure,
what he's most worried about.
Give us something to work
listen,
on,
to listen to. So, of course, though, it is true that, and I think I should be frank about this, it is true that delays are frustrating. They're frustrating for us in government as well. You know, when we have a plan in place, which is, as I said, an overarching commitment in the programme for government, we absolutely intend implementing it. We run into obstacles, including legal obstacles, and we say, look, here's perhaps a better way of achieving the commitment that we've given. And that's what I'm saying, honestly to the people and honestly to Caoimhghín. We'll do this, but we may have to do it in a slightly different way.
And are you confident that you're going to get the cooperation of the GPs? I know you talked about being in conversation or in discussions with the IMO and so forth, but I mean, they could have you over a barrel now if you say you're going to do something by 2015, by the end of your term in office. The price may be very high.
I think clarity is what everybody would like to see, including the GPs. They're very professional people, they're very good people, they're at the heart of the health service. I want to work closely with them, and I think that they want this to succeed as well.
And clarity with respect, if I may, clarity and James Riley with respect to you, Minister of State Alex White, simply don't appear in the same sentence.
And just by way of further clarification, if you want to give us, Alex White, the bigger plan to have universal health insurance for all, again, a 2-term objective. I mean, how much progress has been made on that so far?
That was always a 2-term objective. It's sometimes conflated into this, and people like Caoimhghín and others say nothing's happening in relation to it. We said we would do that in the second term of office of the government. We would do the preparatory work in the course of this term of office of the government. A lot of work has been done. Again, there are complexities to it. We published a document on Money Follows the Patient, a very good document, which is one of the bedrocks of universal health insurance. And we are working very, very carefully and constantly on this question of the white paper, and we will have it this year.
OK, Alex White, Caoimhghín Caoláin, thank you both indeed for talking to us.